also know, actually, that the number of drug-related deaths in the southeast has increased by 35% since 2013. Let's talk now to Paul North from the drugs research organisation Volteface. Thank you so much for joining us on the Wake Up Call this morning. It's sad to talk about any deaths, let alone an increase in drug-related deaths. What do you think's happening?
Well, I think there are a number of things going on, really, and thanks for having me on.
Pleasure.
The first one is we're not adequately educating young people and adults, to be honest, on the risks and harms of drugs in the UK. To compound that, we're also seeing an increase in drugs being sold on social media, and many young people go into social media to get information about drugs. So I think there are a number of things that are compounding the issue. The availability of drugs is, I would argue, at an all-time high in the UK. I think it's easier for people to get drugs than it has been before. And all these things really make it imperative that we do deliver effective evidence-based drugs education for young people up and down the country.
Do you think lockdown had a part to play in the deterioration of mental health and, of course, then perhaps people with time on their hands online and actually stumbling across those drugs which you say are very available?
Yeah, definitely. I think it's a really good question. So during lockdown, we actually did some research with young people online, and we asked them, how has your drug use changed during lockdown? And we noticed a very, very significant increase in the use of benzodiazepines and of cannabis. So our interpretation of that is they are drugs that people can often use when they're feeling quite low, not having much to do. They're not kind of out socializing drugs that you might see at parties. So I think lockdown has certainly had an impact. But this just goes to show that how important drugs education is, because trends change, social factors change for young people, and we need to keep providing them with relevant, accurate information to help them make informed, sensible choices. We can't just give people a little bit of information and think, oh, there you go, that's your 1 hour of drugs education for your entirety of your secondary school, and leave it there. We need to be constantly updating and reminding kids of the harms, of the trends, and giving them opportunities to discuss these things, rather than it being a stigma by which the kid thinks, well, if I mention this or ask a question, I'm going to get myself in trouble.
Yeah, especially as you say, drugs are everywhere at the minute. How powerful do you think it is then to hear from somebody who's experienced tragedy firsthand, like Kim?
I think there is some power in using it. So I spent 9 years working in drug treatment services up and down the country, helping young people and adults overcome problematic patterns of behaviour. And I've seen the power of someone saying, look, here's my experience. This is what I've gone through, and I want to give you a message. But that it's not enough on its own.
Okay.
If you look at the evidence around what effective drugs education looks like, you need to have honest, open conversations with young people. You need to demystify it. You need to fundamentally give them places that they can go and get support and people that they can speak to if they have a worry and a concern. So those stories can be useful, but it doesn't go far enough. There needs to be another layer to that in which young people feel supported and feel like they can have an honest, open conversation.
So where does that need to come from then? Is it up to teachers to provide that, or is it actually about maybe young people like yourself going into schools?
Yeah, that's a good question. So I think fundamentally, I think it needs to be delivered based upon the evidence by professionals. I think I'm critical of how far the government haven't gone on this issue. I think that they could quite easily provide clear guidance. In fact, the Department of Education have written on the subject and said, look, this is what evidence-based drug education looks like. The government just haven't included it as part of their RSE policy. So there are some things that I think we should avoid. That would be people going into schools and scaring kids, showing them pictures of prison cells, the police going in and kind of stressing out kids. I think we should avoid those kind of interventions and instead have professionals go in, have people who can speak very clearly and openly. And fundamentally, we have an evidence base for what good drugs education looks like. We just need to follow it. The issue is, because of the morality of the issue and the stigma attached to the issue, sometimes we can deviate from that and provide interventions or practices which feel like they're the right thing to do. But unfortunately, when you look at the evidence, they're simply not.
Yeah, and it needs to be evidence-based. Listen, Paul, good to talk to you this morning. Time was short, but really good to have your insights. And please do join us again on this topic. That's Paul North then from Volteface, the drugs research organisation. Interestingly, actually, the Department